Hi, Dr. Scott Jensen here. Today I just want to talk a little bit about asthma versus hay fever. A lot of times people ask me that question. First off, hay fever has another name in the world of medicine. We usually call it SAR, or seasonal allergic rhinitis. The bottom line is the symptoms of seasonal allergic rhinitis or hay fever are generally from the vocal cords on up. Runny nose, sneezing, itchy eyes, scratchy eyes, plugged ears, your eustachian tube isn't functioning very well. You might chew something and you feel clicking and popping and your hearing goes in and out, those kind of things. That's hay fever or seasonal allergic rhinitis. But below the vocal cords, same process, but that's where asthma hits. That's where we're using our stethoscope. We're listening for wheezing. We're listening to see if there's infection. With asthma, two big symptoms that people will experience will be cough, frequently a non-productive cough. You're not coughing up a lot of yellow-green phlegm. You're just coughing. It's sort of an irritant cough. There's inflammation going on in those bronchial tubes leading down to your lungs. Cough and wheezing, and then occasionally it'll get to the point where you have frank shortness of breath. But asthma is the same process as hay fever. It's an immunologically based process where antibodies will glom onto antigens, cause the release of a variety of chemicals, molecules, frequently histamine. That will lead to symptoms. Oftentimes those symptoms will be related to the specific effects of histamine molecules, leaky membranes, swollen tissues, itchiness, and so we treat them with antihistamines. Asthma is best treated ahead of time, and you need to confer with your physician about that. But we often talk about the treatment of asthma in both prevention and, if you will, rescue. So we want to prevent the symptoms, but if we can't, then we have to be prepared to rescue the patient from symptoms. Prevention might be things like antihistamines, might be an inhaler that has long-acting medicines in it, might have steroids in it. The rescue would be that albuterol inhaler you're used to taking 2 puffs of to get you instant relief. A rescue agent might also be pills. Prevention might be something like Singulair. There's a variety of things we can do. But the bottom line is, in the world of asthma, we think about prevention and rescue. In the world of allergies, we think about asthma, hay fever. Hay fever is far less likely to cause a health crisis than asthma, but both powerfully impact on your health. And oftentimes you can have one or both. I hope that helps. Thanks.